So the standard operation used to be an open abdominal incision, and approximately 20 years ago, we became one of the first centers in Michigan to use endovascular aneurysm repair, and this is accomplished minimally invasively through punctures or incisions in the groin, where we insert a device up within the aneurysm, build a endograft inside that prevents pressure on the aneurysm and therefore treats the aneurysm, and it can be performed a lot less invasively than the previous operations. Fenestrated endovascular repair is done when the aneurysm is a little bit more complex and may not have the suitable anatomy. Typically, the aneurysm is closer to the kidney arteries, and when we do the procedure, we have to preserve or maintain blood flow to the kidney arteries, and we do this by cutting holes in the graft at the location where the kidney arteries are, and that allows us to maintain perfusion to the kidneys, yet fix the aneurysm in this minimally invasive way.